invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we're talking about a new topic tonight. I want to talk just a moment about HIV infection and HIV patients having cancer. Now, there's an article in the ASCO Post just this week that talks about HIV-infected people. HIV-infected people have about a 2 to 4 times more likely chance of having no treatment for their cancer than non-infected cancer patients. Where did it come from? From a large study from Penn Medicine's Abraham Center. The study was done by Dr. Sohija, who's assistant professor, and was published in the Journal of Clinical Oncology. Now, this was reported in the ASCO Post. Life expectancy for HIV-infected patients is actually similar to non-infected people. So can you believe that? For those of us who remember back to the 80s when so many people were dying with HIV, now life expectancy is about the same whether you have HIV infection or not, which means most people with HIV have a great survival. But survival for HIV patients who develop cancer is not. 2 to 4 times as many HIV cancer patients don't get treatment. Why? Well, we don't know exactly why. In the article, it says for early stage cancers that have the highest chance of cure with appropriate treatment, those with HIV were 2 to 4 times as likely not to get appropriate cancer treatment. HIV patients have lymphoma, lung cancer, prostate cancer, colorectal cancer, were twice as likely to be untreated compared to others looking at age, gender, race, and stage. So, it's a call to action. If you know someone with HIV and cancer, you may want to push them to get treatment. Many years ago, they thought HIV was not treatable. Well, it certainly is, and often the cancer is. And I want to talk about one of those patients tonight. Incidentally, we had the article this week, and a man came in, 67 years old, HIV positive since 1986. So for 30 years, he's lived with HIV. He has been on medication. He now has anal cancer with liver metastasis. About 2 months ago, he developed anal bleeding. There was blood from the rectum. There was blood on the stool. Blood was dripping. He had pain. He went to the hospital, emergency room, went to one hospital. They didn't even speak to him. And he went to another hospital, and they worked him up. They found that he had anal cancer with liver metastasis. He said he never had anal sex, by the way, if you're thinking about that. He's a biker. He's in great shape. He's about 6 feet and muscular. And he has a lot of pain. He has a big mass in the anus and the rectal area. It's going up into the rectum. And he has liver metastasis. So there is good results for anal cancer, whether you have AIDS or not. And many people do not have AIDS but have anal cancer. It's a fairly common disease, and we're able to attack it with radiosurgery, which is focused beam treatment. Usually give some chemo to sensitize the cancer to the radiation. Usually it's a course over a short period of time, and most commonly the cancer will melt away. Now in this man's case, we'll probably also talk to him about treating the liver metastasis with similar technology, the body radiosurgery, and most likely he'll have a nice response. That's what we're used to seeing, AIDS or no AIDS. That's what usually happens for anal cancers. It's a very sensitive kind of cancer. And going to the other part of the body, we had a man coming in from Connecticut who had a skin cancer on his scalp. He's very fair complected, really pale, whitish skin and blue eyes, you can imagine. And he had a skin cancer treated with Mohs, M-O-H-S, surgery, which is like slicing a salami. They keep on slicing until they don't see any cancer. Well, in his case, he lost much of his scalp and the top of his head from the slice. And then they weren't able to get it all, and they gave him a skin graft because they sliced so much, and then they gave him standard radiation. Well, he heard about our program of focused beam treatment and came here from Connecticut and wishes to have treatment for his 2 new squamous cancers of the skin. We treat a lot of skin cancers. We treat squamous cells, basal cells. We treat melanoma often when it's metastatic. We treat Merkel cell, and we've talked about that in recent weeks. We had a patient come from Texas for Merkel cell cancer, and he called in saying his cancer has shrunken nicely after treatment. So for this gentleman, he doesn't want any more Mohs surgery. We've talked about surgery for other diseases tonight. He wants to go with focused beam treatment. He wants to avoid the surgery, the skin grafts, and the extensive prior radiation that he had before. And we'll report back, but the success rate is very high in our hands. We treat a lot of skin cancers, especially around the eyes, ears, nose, and mouth. Those tissues and organs are really hard to duplicate with surgery. It's probably better to keep what God gave you. And I want to talk just for a moment about an article that was in the Atlantic this week, an Atlantic article titled "Cancer Vaccine Exists, Goes Unused." So it's a very provocative title by James Hamblin. Every 20 minutes, he writes, a person in the United States is diagnosed with human papilloma virus-associated cancer. Every 20 minutes. A person in the United States is diagnosed with a human papilloma virus cancer, and most of those cancers could be prevented with a human papilloma virus vaccine, but fewer than half of American children who are eligible for the vaccination get it. Now you're looking at a next generation that may be getting diseases of the head and neck, cancers of the head and neck, the pelvic areas, the cervix, the penis in men. You're talking about saving lives in the future. Now, often parents don't want to give a vaccine that implies the child one day is going to become sexually active, but most likely one day the child is going to become sexually active. And if we could prevent human papilloma virus infection and prevent the cancers related to human papilloma virus, wow, what a difference it makes. Now, most teens are already in their doctor's office getting vaccines when they're 11 or 12. So it could easily be a vaccination rate of 91%. The rate right now is 47%. So maybe the best thing you can do is to talk to your doctor about getting the human papilloma virus. Not all doctors are talking about it. Some are uncomfortable to talk about it. If you have questions about it, give me a call during the week. This is Dr. Lederman from Radiosurgery New York. We're just about the end of the hour. Our next show is going to be Saturday morning at 5 a.m., which will be a brand new show. If you have questions, call us at 212-CHOICES, 212-CHOICES, which is 212-246-4237. Thank you for listening. God bless you, and have a great week. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212-CHOICES. That's 212-246-4237. That's 212-246-4237. Till next week.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within one business day because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom-tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
The proceeding was a paid program. WOR's airing of this program constitutes neither an endorsement of the products offered or the ideas expressed, 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 or the ideas